Good afternoon. My name is Roquel W, and I will be presenting my Plan Change project on decreasing length of hospital stay with an emphasis on early ambulation. This project is for the classes of nursing research and transition into safe practice with Professor Hazel Dangowick and Professor Jasmine Childress. Here you'll find my my table of contents, my index. So first I'm going to be discussing my change theory. The change theory that I decided to go with is Cotter's 8-step change model. Cotter's change theory is a well-known change management model. It can also be applied to reducing the length of stay in hospitals. So I'm going to just basically discuss how each step of the 8-step model can be applied in context. So establishing a sense of urgency. So I would highlight the importance of reducing the length of stay in hospitals to all stakeholders. This could be through showing data on how long hospital stays affect patient outcomes, hospital costs, and the efficient use of resources. Then next, I would create a guiding coalition. So this would form a team of individuals who are influential, such as nurse leaders, physicians, administrators, and other healthcare professionals. This team will help drive the change process. Next, I would develop a vision and strategy. The team should create a clear vision and strategy for reducing the length of stay. This could involve improving care coordination, implementing evidence-based protocols, enhancing discharge planning, so on and so forth. So then next, I would do communicating the change vision. So communicate the vision and strategy to all staff in the hospital. This can be done through meetings, newsletters, or workshops. Fifth, empower board-based action. Remove barriers that could hinder the change process. This could involve providing resources, training, and support to staff. Encourage innovation and idea sharing among staff to find the best solutions. Generating short-term wins. So that would be set achievable goals and celebrate when they are reached. This could involve recognizing and celebrating when certain milestones are reached, such as specific percentage reduction in the average length of stay. Next, I would consolidate gains and produce more change. Use the credibility gained from the short-term wins to change other systems, structures, or policies that don't align with the vision. This could involve further improvements in care coordination, patient education, or discharge planning. And then lastly, anchor new approaches in the culture. Make the changes part of the core hospital culture. Ensure that the new ways of doing things are taught to new staff and included in the onboarding process. So basically, using Cotter's change theory, nursing leaders can guide their organizations toward the goal of reducing the length of stay in hospitals, thereby improving patient outcomes and hospital efficiency. This process, however, requires consistent communication, engagement, and reinforcement to ensure lasting change. So moving forward, I will go ahead and I will discuss the problem at my particular facility. So I was at MLK Community Hospital for my preceptorship, and Martin Luther King Community Hospital is a 131-bed nonprofit facility in an underserved community in South Los Angeles. The issue that I'm focusing on is the extended length of stay. So Martin Luther King's daily occupancy functions at 106%. Most admissions do come through the ED and create throughput and capacity issues. So my PCOT statement is, among patients admitted to the community-based hospital post-surgery, patients who ambulate early after surgery significantly reduce post-op complications, shorten the duration of in-hospital stay compared to patients who do not ambulate early within 24 hours post-surgery. In terms of impact, when it comes to decreasing the length of stay, the length of hospital stay is a very important indicator of health services and resource utilization that is used to evaluate the efficiency of hospital administration and patient quality care. How does this help? Decreased length of stay has been associated with reduced risk of nosocomial infections, positive treatment outcomes, lower mortality rates, and reduced cost burden of healthcare. And then 3 of the largest barriers to discharge from a hospital are communication, care, coordination, social and socioeconomic factors. It's important to note that healthcare professionals work diligently to address these barriers and ensure a safe, smooth transition for patients during hospital discharge. Now I will discuss the plan of action. Okay, so here I'll talk about my plan of action. I know that we have to choose 3 different areas to focus on. So my first will be early ambulation benefits. Obviously, ambulating or walking and moving around post-surgery is important in reducing hospital stay for several reasons. So 1, preventing complications. Prolonged bed rest after surgery can increase the risk of complications such as blood clots, pneumonia, and pressure ulcers. Walking and moving helps improve blood circulation, prevents the pooling of blood in the legs, and promotes lung expansion, reducing the likelihood of these complications. Next, enhancing recovery. Ambulating helps improve muscle strength and flexibility. It prevents muscle atrophy and aids in maintaining joint range of motion. It also promotes bowel movement and prevents constipation, which is common after surgery due to anesthesia and pain medications. Basically restores normal body function. So early mobilization, getting up and walking as soon as possible after surgery helps restore normal body functions and decreases the time required for recovery. It helps the body regain its normal physiological functions and reduces the risk of post-operative ileus, which is a temporary dysfunction of the bowel and urinary retention. Pain management, movement, and ambulation stimulates the release of endorphins, which are natural painkillers. Walking can help reduce pain and discomfort, allowing patients to rely less on pain medications and facilitating early discharge. Then you always want to focus on the patient's well-being. So obviously, staying in bed for extended periods can lead to feelings of weakness, helplessness, and boredom, which can negatively impact a patient's mental well-being. Ambulating provides a sense of independence, normalcy, and improved mood, leading to a more positive recovery experience. So overall, ambulating post-surgery is crucial for reducing the length of hospital stay by preventing complications, promoting recovery, managing pain, and improving mental well-being. However, the timing and extent of ambulation should be determined by the surgeon or healthcare team based on the individual patient's condition and the type of surgery that was performed. So next, I will go ahead and I will talk about a little bit about care coordination and discharge planning. So this is obviously effective care coordination involves clear communication among healthcare providers, patients, and their families to ensure a smooth transition from the hospital to home or other healthcare settings. Discharge planning starts early in the patient's hospital stay, identifying any necessary post-discharge services, arranging follow-up appointments, and providing education on self-care. The third step in the plan of action is patient and family involvement. Patient and family participation shortens length of stay, has better outcomes, education encourages patient and decision making, and promotes self-management. Families learn to work together. On the side of negative consequences, I went ahead and I touched on all 3 areas of the plan of action, but I'll just stick with early ambulation since that's the focus of this plan change project. So you have early ambulation, which could mean increased risk of falls. Early ambulation may pose a risk of falls, especially in patients who are weak, have impaired mobility, or at risk of orthostatic hypertension. You have an exacerbation of pain. In some cases, early ambulation may worsen pain, especially immediately after surgery or in patients with certain conditions such as fractures or acute injuries. And then discomfort and fatigue. Early ambulation can cause discomfort and fatigue, especially in patients who are not yet fully recovered or have a significant pain or weakness. Nurses should regularly assess patients' tolerance for activity, provide adequate rest periods, and modify ambulation plans as needed. When it comes to operationalizing early ambulating on the length of hospital stay in nursing, standardized protocols need to be developed and guidelines for early ambulation that outline certain criteria. You want to assess patient's readiness. Nurses should assess each patient's readiness for early ambulation by considering factors such as patient's medical condition, stability, pain levels, mobility status, and cognitive abilities. You want to develop individualized care plans. You want to educate patients and families. So you want to provide education to the patients and their families about the benefits of early ambulation. You want to implement mobility programs, monitor and evaluate outcomes. So you want to track and monitor outcomes of early ambulation interventions, including patients' tolerance, progress, and complications or adverse events. And then you want to collaborate with the interdisciplinary team. So you want to work closely with the interdisciplinary team, including physicians, physical therapists, occupational therapists, and case managers, to ensure a coordinated and integrated approach to early ambulation. So here's just a little bit of the review of literature and the summary of evidence. So significant reduction in length of stay when patients ambulate early, exceeding discharge dates is associated with increased mortality and infections. And then patients who were able to ambulate on day 0 were discharged sooner than those who didn't. Some of the summary of evidence: a retrospective study by Grosso resulted that there was a significance between early ambulating and the length of stay post-surgery. A meta-analysis was conducted by Zhang et al. To assess if early mobilization in the ICU reduced ICU weakness, improved functional recovery, improved muscle strength, and shortened the length in the ICU or hospital. The results of the study determined that early mobilization was effective in reducing the length of ICU and hospital stays. So now I'm going to go ahead and move forward and talk about implementation. Okay, when it comes to implementing any type of program or protocol, you want to develop standardized protocols. So you want to create evidence-based protocols and guidelines specific to the type of surgery. You want to have preoperative education. So before surgery, provide patients and their families with information to the benefits of early ambulation. You want to have postoperative pain management, ensure effective pain management to minimize discomfort and facilitate early ambulation. You want to assess readiness for ambulation, evaluate each patient's readiness for ambulating by considering factors such as surgical site, stability, vital signs, pain levels, respiratory status, and cognitive ability. You want to go ahead and initiate early ambulation. Start with simple activities like sitting on the edge of the bed, dangling feet, or performing range of motion exercises. You want to go ahead and collaborate as a team, so involve everybody. You want to monitor and document progress, reassess the patient, and then you want to have patient and family involvement, engage patient and their families in the ambulation process by educating them on the benefits. And then you also want to have ongoing evaluation and quality improvement so that you can go ahead and evaluate outcomes of early ambulation. And some best practices to implement are early discharge to reduce the length of stay is early discharge planning, medication management, clinical pathways, early ambulation, case management, multidisciplinary care, hospital service and assessments, and consultations. Okay, so who's involved? The responsibility for implementing any early ambulation or programs can be shared among various healthcare professionals, depending on the setting and context. The primary responsibility often falls on the nursing staff, as they have direct and consistent contact with the patients. However, implementing any program may involve collaborative efforts from the interdisciplinary team, which may include these individuals that I listed here. So like I already mentioned, nurses, physical therapists, occupational therapists, rehabilitation techs, physicians, surgeons, and specialists. So nurses play a crucial role in implementing any early ambulation or mobility programs. They assess the patient's mobility status, plan and coordinate interventions, provide assistance and support during exercises and ambulation, and monitor progress and outcomes. Nurses also educate patients and their families about the importance of mobility and guide them in performing exercises or activities. And then here I just posted an example of the policy that I created, but this is also in my outline write-up for Professor Dangowick. So this is just a little glimpse of it here. So then now I'll go ahead and I will move on to the evaluation part of it. Evaluating early ambulation post-op involves assessing the effectiveness of early ambulation in improving patient mobility, functional recovery, and overall outcomes. So here are some of the steps to evaluate early ambulation in decreasing the length of stay. You want to determine evaluation parameters, collect baseline data, monitor progress, measure outcomes, seek patient feedback, involve the interdisciplinary team. You want to go ahead and analyze data and identify areas of improvement, implement those improvements, and then reevaluate and reassess. So by following these steps, nursing professionals can effectively evaluate a mobility or early ambulating program post-op, ensuring that it is tailored to each patient's needs. It promotes optimal recovery and contributes to improved mobility and functional outcomes. And here are my references. And that's it. Thank you.